And when we start insulin therapy, we typically start with a special form of insulin called basal insulin, a type of insulin that can be administered once daily and give improvements in overall glycemic control for our patients. So what do basal insulins look like? Ideally, you want a basal insulin that has a flat profile. There are other insulins that have come to the market, such as NPH and Detamir, that have not been quite as flat as Glargine. And even though on this graph represents an idealized version of Glargine, it is, in terms of first-generation basals, the most flat in its profile. But it doesn't mean we couldn't go flatter. Yes, we have the development of new second-generation basal insulins, where we have an even better, more effective profile for our patients. Compared to Glargine 100, which is Lantus in red, Glargine 300, or Toujeo in blue, has a more flat profile and has a more extended time frame of action, giving rise to exactly what we want out of a true basal insulin. Greater physiologic approach of how we secrete basal insulin in our own bodies over the 24 hours. What we see with Glargine U300 or Toujeo is that we have great efficacy, very similar to Lantus, but we have a reduction in hypoglycemia, in particular nocturnal hypoglycemia. And as our first mantra in medicine states, first do no harm, this clearly is starting to fulfill some of that promise. In clinical studies, we see that both with Toujeo and Lantus, A1Cs were about 8.15, 8.16, and we see very good reduction. Toujeo down to 7.25, with Lantus 7.28, and in particular, we see fewer episodes of hypoglycemia along the way to improvements in glycemic control. So that's what we want to see from medicine, helping our patients get to a better physiologic endpoint without undue risks of adverse events. So we have an ongoing quest for better basal insulins. We still want wonderful reductions in A1C. We want to focus on reducing fasting blood sugars in particular. And that's not enough. We demand more. We demand convenience. We want our basal insulins in a pen. We want flexible dosing so we're not beholden to exactly every 24 hours on the dot. We want the ability to mix with other insulins potentially and non-insulin agents. And of course, first do no harm. These medications must be safe. We want low incidence of hypoglycemia, low incidence in particular of nocturnal hypoglycemia, and less individual variability. And if we can get that with less weight gain as well, well, that's just icing on the cake. And so we have the launch of Toujeo. The unique element to Toujeo is that it's Glargine concentrated. And because Glargine has a very unique way that it works in the body, meaning that in an acidic pH of 4, it's in solution. But as soon as you inject into the body and it hits physiologic pH, 7.0, it precipitates. It forms a crystalline depot in the body. And then Glargine, either Lantus or Toujeo, exists as that crystalline depot, and it has slow dissociation of the individual Glargine monomers from the depot into the circulation. Because Toujeo, Glargine U300, is concentrated, it has 1/2 the surface area as Lantus. Because of that, it has a more slow, steady, and reproducible rate of dissolution from the depot and entry into the circulation, providing this flatter profile. Now, if you'd like, I can make a really nice analogy that I share with my patients. Now, please take it with a grain of salt, because this works more in colder climates than in warmer climates as an analogy. But I call it the snowball analogy. So, if you had 2 clumps of snow in front of you, and you wanted to make a snowball, and the first clump of snow, you made a snowball, but it was kind of loose, and it wasn't really compact, and you set that down in front of you. The second clump of snow, you made a snowball, but this was the most dense and tight and well-formed little baseball of a snowball that you'd ever made. And then you put that down in front of you. Let's say the sun came out and started shining down on these snowballs. Which snowball would melt first? The more densely, tightly packed snowball, or the more loosely packed snowball? And it's the more loosely packed snowball that melts first. Not only does it melt first, but it melts in a more erratic profile. The more dense, tight nugget of a snowball will melt slower. And not only would it melt slower, but it'll melt more evenly and maintain that same circular structure for a longer period of time. That is a nice visual representation I give to my patients when I discuss the difference between Lantus and Toujeo, with Toujeo, of course, being the nice, densely packed, tight snowball.
What's nice about these basal insulins like Lantus and Toujeo and other basal insulins is that maybe because of the lower risk for hypoglycemia, monitoring of blood glucose would not be that tedious anymore. Maybe just postprandials after, because it has a flat profile. So meaning you expect only the postprandials, if ever, to be handled by oral anti-hyperglycemics or some rapid-acting insulins. That's a good thing about the basal insulins. But of course, we do still advise diet, proper diet, and of course, nowadays, low fructose for those who are obese or overweight.
Another very important point is that because Toujeo is a long-acting basal insulin, it achieves steady state in 3 to 4 days. So in terms of titration paradigm, if your patient is on a self-titration paradigm, they'll check their fasting blood sugars once a day, first thing in the morning, and they can titrate their Toujeo to achieve goal if that's what the medical team would like them to do. And you titrate the Toujeo not more frequently than every 3 to 4 days. So once to twice weekly. And within the addition study profile, which is the studies done in Toujeo, you went up by 3 units every 3 to 4 days until achieving goal fasting blood sugar.